So, very good morning still. I'll spend a few minutes talking about the Sustainable Development Goals. And you might think, well, what are these things? I've read a bit about them. What do they mean to me and my job? What do they mean in terms of the mental health sector more generally? So I'll try and answer some of those questions in the next few minutes. So, yeah, I'm based in the WHO regional office for Europe. I was formerly in the WHO headquarters in Geneva, moved about a year ago, so I spent all my time traveling around the 53 countries of the European region, trying to advise on health system strengthening in the area of mental health. So here are these SDGs, Sustainable Development Goals, 17 of them. And I think there are 169 targets around these 17 different goals, and even more indicators to provide the information about how much is going to be achieved by the year 2030. So as you can see, covering all manner of different topics, from reduction in poverty, reducing inequalities, at the same time promoting economic growth, improving health, improving transport, dealing with climate change, and so on and so on. So it's a very large, ambitious, comprehensive, and also holistic set of goals that have been brought together here after much consultation within the UN, with all of the governments and NGOs and all other relevant stakeholders. So you could say, well, okay, so what? What's different about these SDGs? We've had previous development frameworks, the Millennium Development Goals in particular. I think some outstanding or differential characteristics of the SDGs compared to the MDGs, they're even more global and even more universally applicable. A lot of the health-related MDGs, for example, were about tackling malaria, HIV, TB in low and middle-income countries. The SDGs is a much broader set of health-related goals, for example. So whether it's low, middle, or high-income countries, all are involved. And it's even more intersectoral in its ambition and nature. And you can see some of the guiding principles there on the left, which are meant to be engendering strong partnerships and action across different sectors and different parts of government in particular. So very much a whole of government approach. And then another outstanding characteristic or feature of the SDGs, I think, is around the very clear focus on equity and social inclusion, and this motto, which you may have hopefully have heard already, which is the concept of leaving no one behind. And so these are some of the characteristics that are embedded within the SDGs across all 17 of the goals. Okay, so now let's think about mental health and the SDGs. So most clearly and directly, mental health is included specifically in the health-related goal. Target 3.4 is the one on NCD, so reduction in premature mortality, but also this highlighted sentence of promotion of mental health and well-being. Now, this is really important to have this in there. Because if you don't have it in there, that's a sure sign for continuing neglect of this sector. So the very presence of this sentence is really important. It had to be fought for, but it's there. It's a specific other target on substance abuse, prevention and treatment of substance abuse, and also a more broad goal around this concept of universal health coverage, so that all people have access to services when they need them at a cost which is not going to be hurting them or their households. So this is the direct inclusion of mental health in the SDGs. But my question to you would be, well, what actually is influencing mental health well-being? It's a very broad sort of concept, of course, and we know that there are many and complicated set of underlying influences and factors that will inform or influence each and every one of our mental health, right from genetic biological characteristics through to our early formative development and how we are able to emote and relate to each other, through to where we were born, what's the neighborhood like, and what's the education, and then what are our living and work opportunities, and so on. And then more structural or macro features as well around, for example, if the effect of crisis or conflict or even macroeconomic policies on mental health. So there's a broad range. And what I want to just mention here is some nice work that's been recently done, which tries to map the different risk factors that you can see up there, from very proximal risk factors to do with our age or sex, to do with, for example, unemployment and debt. We know what effect that has on, for example, depression. But also a range of more distal factors. So if we're talking about debt and unemployment, that's at the sort of individual or household level. But then as I mentioned, broader issues in play. For example, the huge effect that economic recession has had in Europe and elsewhere, and how that is related to mental health outcomes, including suicide rates. If we look, for example, at again at the one at the bottom around the social domain. So we all have social networks, and if you go beyond that, there are social capital that is there or not there to such an extent at the neighborhood level. So this is a whole range of different factors that have been nicely described in this recent paper by Crickland and others as part of a input into a Lancet Commission on Global Mental Health, which will be reporting later this year. So I encourage you to have a look at that, because it does a nice job of mapping these different SDGs to these known risk factors. So then putting that into a kind of life course approach and thinking through the interventions that, for every risk factor, there's also a protective factor, in the positive sense. So we want to reduce the risk factors, and we want to enhance or embellish the protective factors. And these are some examples of interventions that can do that across the life course. So my key message to you is that I think, you could say, well, SDGs, so what? But actually, I think SDGs, so a lot, in the sense that they provide a strong and unifying framework that is accepted by all governments, and really provides unusually strong opportunity to really make a difference in the area of mental health because of all those connections that I pointed out. So both in terms of the health goal, having there in the first place is very important in terms of getting it on the agenda for universal health coverage, for example, and strengthening mental health promotion and protection, not just in the health sense, but also in the social sense and the human rights sense of protection. But also these other non-health goals as well, and being able to see these links between mental health and these other SDGs, particularly these underlying risk factors that I've just spoken to, I think is really provides an extraordinarily important opportunity to do more in this area. So that's all I had to say. Thanks a lot, and I'll take some questions, or how do you want to do it? Up to you.